Okay, so this is one of the 6med surgery sessions that we're running. These sessions run every Sunday, and there's sort of 1 to 2 hours basically, and it's to try and give you a better insight of different areas of medicine. And the topic I'm doing today is the role of a medic or a doctor in a humanitarian crisis. So some of you might know a little bit about a humanitarian crisis, some of you might not. But it's just to sort of give you an understanding of, first of all, what is a humanitarian crisis? How does it affect people? Who does it affect? And in fact, what is our role as medical students and doctors in getting involved in these humanitarian crises to help people, and especially with the healthcare side of things. So that's what I'm going to be talking about today. So let's move on to the next slide. So a little bit about 6med here. So let me just move the chat box aside before I start. So 6med is a company which has been running for about 6-7 years now, and we've taught over 10,000 students. And our main role is that we created this website for which was created by medical students to help other medical students or students interested in studying medicine. The types of courses we run are these surgery webinars like the one I'm doing today to get you interested in different areas of medicine, and then offer other things like UCAT and BMAT support. So for your entrance exams, if you wanted to, we do these large group courses later on in the year, and we do interview preparation usually November, December time and January time for people who've got interviews and they want to train for things like multiple mini interviews and panel interviews as well. So we give lots of feedback to students who attend those courses. So that's the kind of thing we do, and we just want to help as many students get into medical school and help them along with their medical school application process. A little bit about me. So I'm a 4th year medical student at Bristol. I'm currently intercalating in Imperial College London, and I'm studying endocrinology, so everything to do with hormones, which is something I'm quite interested in. Since I was in 1st year, I've had a passion for teaching, and that's why I do these sorts of things. So I've been working with 6med for the past 2 to 3 years, and I've also been working as a part-time tutor to help students with their medical school admissions, whether it be their interviews or their personal statements or their UCAT tuition. So I teach students various aspects related to the medical school application. This next bit, it links nicely with the presentation I'm going to talk to you about. So my interest currently is going into surgery or going into army medicine, and both of them sort of nicely link to humanitarian medicine, because army doctors and surgeons, there's a high demand for them in humanitarian crisis areas where they need to do sort of emergency surgery or look after people, trauma patients on the field or in areas where they're undergoing a humanitarian crisis. So that is something I'm quite passionate about at the moment. So let's move on to the actual presentation today. So the agenda for the morning today is, first of all, we're just going to try and understand what a humanitarian crisis actually is. So I'll just give you some definitions, try and help you understand how you can recognize one and what happens during a humanitarian crisis and what are the common themes that you see in a humanitarian crisis. Then go through some examples. So some of the most recent ones, as we know, is the Russia-Ukraine conflict. And then we also have things like COVID, which has been a global crisis. And then a few years back, the Ebola crisis in Congo as well. So we'll go through some of those. Then we're looking at how do medics and doctors actually fit into the humanitarian crisis? What is our role in a humanitarian crisis? And then I'll talk a little bit about MSF. So MSF is a charity organisation. You guys might have heard of it. I'll go through a little bit about what they do and how doctors can can get involved with MSF in order to help people undergoing a humanitarian crisis. And finally, we'll talk about a few medical career paths that you might be interested in related to humanitarian medicine. So moving on. The aims that I want to get across today to you guys is to help you understand the role of a doctor and the fact that that role is holistic. It's not just about giving a medicine to a patient and sort of sending them away. It's more than that. It's realizing that the decisions that you make for a patient or for a community doesn't just affect that particular community, it affects a wider aspects of life as well. And then for you to get a better understanding of career opportunities within humanitarian medicine, as I said. Okay, just some housekeeping, which you guys have already been following anyway. So just make sure you're on mute during the session to avoid any disruptions as I'm giving the presentation. And as I said before the session, I aim for it to try and be quite interactive, because it can be quite hard to stay engaged when it's Zoom and I'm sort of talking at you. And to avoid doing that, I've put in some interactive slides for everyone as well. So all you guys need to do is, if I ask a question, just type the answer to the chat box and we can go from there. And as I'm going through the presentation, if you think of any questions that you may want to ask me, type them in the chat and I'll get to them at the end of our session or in the middle of the session as well, if we take a short break there. But usually it tends to be quite an easy to read a presentation, so I'm most likely going to answer the questions right at the end. So if everything's okay, we've got the boring stuff out the way, let's start with the actual presentation. So a little bit of audience participation. So on a scale of 1 to 4, how confident are you guys with this topic? So 1 being not confident at all, 4 being very confident. So you can just type in the number into the chat and I'll have a look in a minute. I'll give you guys about 30 seconds. So let's have a look at the chat. Okay, so most people saying 1s or 2s. Okay, just give a few more seconds for others to answer. Okay, so mostly 1s and 2s, which is what I would have expected in the beginning. And by the end of this, I'd expect it. I'd sort of want to get you guys to hopefully about a 3 or a 4 with my presentation. So let's get going. So first of all, what is a humanitarian crisis? So a humanitarian crisis it can be any event which sort of affects the health, the safety and the well-being of lots of people or a large community. And when this happens, you usually get limited resources for this community, and it makes, because they don't have as many resources, whether they be sort of access to medicines, access to clean water, access to good hygiene, all of those, when all of that access is limited, it makes those individuals within that community really vulnerable to further harm. So becoming ill because they're not able to maintain their hygiene, or not being able to maintain their health. Okay. So there's loads of different things that can cause a humanitarian crisis. I loosely have categorized them into these 4 sections. So natural disasters is a really common one. So if any of you remember the Haiti earthquake in 2010, that caused a massive humanitarian crisis in Haiti. And we can also have things like tsunamis or, volcanoes. Obviously, those are not as common, or sort of hurricanes, especially in America. So all of those things can destroy housing, it can limit your access to medicines, and that can then increase your risk of getting ill. So that's one of the causes of a humanitarian crisis. The next one is famine. So that can come as a result of war. And then you can have disease outbreaks. So the most common one we've seen recently is COVID. And then we can have also, in the past in Congo, we've had the Ebola outbreak, we've had malaria in developing countries, and then measles outbreaks, which happens, everywhere. So disease as a result of a humanitarian crisis. And finally, war, because conflict tends, mediated by political unrest, can cause limited access to food, water, and different things. Okay. So who does a humanitarian crisis affect? So this is a definition which was taken from one of the humanitarian aid organizations. So it says that the humanitarian crisis can affect everyone involved in the immediate vicinity of that community. I do agree with the statement, but I also think a humanitarian crisis, it doesn't just affect the community themselves, it also affects the people around them who are trying to find different ways to help them as well, and offer humanitarian aid. So technically, a humanitarian crisis affects everyone, because it gets us thinking about how we need to help people, how we can change things in society to prevent it from happening in the future as well. Okay, so with any humanitarian crisis, the problems that occur after the crisis happens or when the crisis is happening is the same. So the easiest way to think of it is, first of all, we have the crisis occurring. So if I use the COVID outbreak as an example, for instance, we have the COVID crisis occurring, and then the health and safety of people being compromised because we've got the spread of infection, and it's an airborne disease. And we had lots of things like self-isolation, lockdowns, tears in England and things like that. In developing countries, what that can also lead to is things like limited access to water, and that can lead to poor sanitation, and poor sanitation is a breeding ground for things like cholera and dysentery, which are diseases that are very, very common with poor sanitation. With limited access to water, you can also have limited access to housing, which means that lots of people tend to be crammed into small areas, so that results in overcrowded housing. When lots of people are in contact with one another in really, really cramped conditions, we can have, as we know, increased risk of communicable diseases, so things like COVID, as we said, Ebola, HIV and AIDS, malaria and measles, all of them are easily spread, infectious diseases basically. If you have limited access to housing, that you might also have limited access to food, and that can lead to things like malnutrition and famine, especially in younger children. And then the last thing, you can also have limited access to healthcare. And when you have limited access to healthcare, that can be a breeding ground for lots of different problems. So you have lots of high risks to maternal and child health if there's not enough access to contraceptives, or if there's no access to vaccines. There can be an increased risk of death because of these infectious diseases risk that I've talked about before. And it can also increase your risk of trauma. So for instance, if it's a humanitarian crisis caused by a war, for example, the Ukrainian conflict, and someone is injured, then they're less likely to receive the healthcare they need in order to survive. Okay, so again, looking at the trends in a humanitarian crisis, this is just a graph, again, taken from one of the websites which offer humanitarian aid. And it's just showing, for instance, if a disaster or a humanitarian crisis happens, what sort of happens to the mortality. So mortality increases at first, and then it sort of plateaus. But then you have right after a humanitarian crisis occurs, that's not the end of things. It sort of is a breeding ground for other things, like as we've seen the waterborne diseases like cholera and dysentery, vector-borne diseases like malaria, and then you've got also psychosocial issues. So lots of people their mental health may be affected, especially in conflict zones. Lots of people stuck within the humanitarian crisis tend to have things like post-traumatic stress disorder. So how do we deal with all these problems? And that's where the role of medics come in, which I'll talk about in a bit. So a little bit of audience participation again. Can you guys think of any humanitarian crisis that you might have heard of? And if you just type your answers into the chat, and I'll have a look in a minute, and I'll give you guys about 45 seconds. I've mentioned a few already, so you could talk about them or talk about other ones which I may not have mentioned yet. Okay, so we've got a few different ones. Yeah, Palestine, famine in Yemen, yes, those two are really good. Any other humanitarian crisis anybody else can think of? Someone has said destruction of Japanese nuclear station due to tsunami. Yes, perfect. Palestine, Afghanistan, perfect. Yes, thank you. Anyone else? or the same, if you've already answered, if you can think of other ones, you can add those to the list as well. Okay, I'll stop there. Let's go through the ones I've got on my list. So yeah, so you guys came up with a really good list. These are some of the other ones. This is not an exhaustive list, so there's lots of different humanitarian crises that have happened in the past. These are just the main ones that I've picked out from the recent years. So the main one that's happening now is the Russia-Ukrainian conflict. And then we also have the COVID-19 global crisis. Those are the two I've highlighted because those two I'll be discussing in this session. And then we also have the Afghan crisis. I think someone mentioned Afghanistan. And then the Syrian crisis as well. This one's a big one, so the Democratic Republic of Congo conflict. And then after the conflict, they also had the Ebola outbreak. So the South Sudan crisis, the Iraqi conflict, which has been going on for a while. As I mentioned, the Haiti earthquake in 2010, which is what this picture on the left shows as well. So we've got loads of the humanitarian crises which have happened in the past, and doctors and medics having to take on a role, a healthcare role, in order to help in these different examples. Okay, so going on to the Russia-Ukrainian conflict, because that's the most recent thing that's happened. So in February 2022, Russian forces attacked Ukrainian cities, and since then 4 million people have become refugees and they haven't had access to food, clean water or medicine. People who have fled the country because it's still quite cold in Ukraine at the moment, a lot of them have suffered from things like hypothermia, which is when you get really cold, and dehydration because of limited access to water. Now MSF, or Médecins Sans Frontières, it translates to Doctors Without Borders, and it's doctors who've sort of worked with this non-governmental charity organization in order to help people and offer humanitarian aid. And at the moment in Ukraine, MSF has a massive role. So they've done lots of different things, of which I've just picked out a few. Currently, they've increased shipments of emergency medical supplies like insulin to people who have diabetes. They've donated medical supplies to local hospitals. They are trying to deal with mass casualties as quickly as possible. And I'll talk about how you deal with mass casualties in a humanitarian crisis a bit later. And they've donated a lot of cold weather items to try and prevent, in more cases of hypothermia in Ukraine as well. Of course, they've done more than that. These are just the 4 things that I've picked out. Okay, so I want to see if this YouTube video works. Let me just click on it and see. Okay. Was everybody able to hear just the start of that? I'll try and increase the volume as well. Just somebody say yes or no in the chat. Oh, okay, perfect. So I will play it again from the start and just listen to what they say. This is what MSF is doing for the Ukrainian crisis.
Nos équipes d'urgence sont arrivées à la frontière entre la Pologne et l'Ukraine. Elles tentent actuellement d'acheminer du personnel et des fournitures essentielles en Ukraine et de mettre en place des activités d'intervention d'urgence des 2 côtés de la frontière. Entre l'Ukraine et la Pologne, nos équipes voient des personnes traverser à pied, en voiture et en bus, souvent épuisées. Certaines arrivent avec des enfants âgés de 25 jours seulement. Beaucoup de ceux qui ont traversé la frontière polonaise nous ont dit avoir passé de longues heures dans des files d'attente, alors que les températures sont glaciales. Certains étaient déshydratés et d'autres souffraient d'hypothermie. Nous avons fait don d'articles de première nécessité à un centre d'accueil en Pologne et nous nous efforçons d'intensifier notre réponse. En Ukraine, des équipes MSF ont distribué des kits pour blessés de guerre à Mariupol. Et...
So I'll stop it there. So as I said, as the bullet points I mentioned as well, they are doing a lot at the moment, and they're trying to increase the amount of doctors who are able to go from different countries into Ukraine or areas like Poland to offer help, and especially to injured people in Ukraine. Okay.
Nos équipes d'urgence sont arrivées à...
Let's move on. So with this Ukrainian crisis, we know currently they're doing as much as they can, but we also, in any humanitarian crisis, you also need to sort of think about what might happen and prepare for that as well. So what kind of things do we as doctors need to foresee? So as I said before, we need them. There's an increased demand for insulin supply. So insulin is the medicine, as you guys might know, which is given to patients who have type 1 diabetes, or patients who have really, really severe type 2 diabetes. So during things like conflict or any humanitarian crisis, as I said before, we have limited access to healthcare supplies and medicines. And in this case, in the Ukrainian conflict, it's reduced access to insulin. And that can negatively impact on patients' health, because without insulin, especially with type 1 diabetics, they can't survive. So as a result, it's really important to try and get as much insulin to these patients as quickly as possible. So that's an issue that we need to foresee. Another issue, COVID-19 may become a huge issue for these individuals again. As you saw in that video earlier, they were all sleeping in cramped spaces, queuing up in really cramped, overcrowded spaces, a lot of them having things like hypothermia, may not be living in the best hygienic conditions, and just in overcrowded areas. So as a result of that, it could cause another massive surge in COVID-19 cases in Ukraine as well, or amongst those people, amongst those refugees within the Ukrainian crisis. So that's something we need to look into. Maybe we need to send them more supplies of masks, COVID vaccines, and sort of queuing them up in a way that's they're socially distanced and things like that to help them as much as we can. So moving on from the Ukrainian crisis to a slightly different one, because this crisis, rather than being caused by war, it's being caused by disease, basically, an outbreak of a disease. So as we know, 2020, there was a global disease outbreak, which crippled even the most advanced healthcare systems. So a lot of the times when we think of humanitarian crisis, we think of places outside of the UK or America or things like that. But actually, because this was a global outbreak, it affected almost everyone. And even really, really good healthcare systems like the NHS struggled a lot, especially with the amount of patients coming in. And on top of that, if we think about countries with more fragile healthcare systems, they've had a worse hit by the virus because of lots of different things. Again, things like overcrowding, lack of housing to self-isolate for those individuals, lack of access to water and soap for hand washing, and limited access to masks and vaccines as well, which increases the risk of them contracting COVID in those countries. So what can we as medical students and as doctors more likely do? And in the COVID-19 crisis, this is what we did. So I've split it into the Western world versus developing countries, because we did have slightly different measures, because the needs of the individuals in each country was different based on what we had. So in the Western world, the most common things to do was self-isolation, lockdown, and using the tier system, and having public health campaigns to sort of say, you know, wash your hands for 30 seconds and wash it properly with soap and water. And then we also had other things like wearing masks on public transport. And then we had the vaccination regime, where the most vulnerable people were vaccinated first before vaccinating everybody else, and people who couldn't receive the vaccine, so people who had cancer or really old or really young people, because they're the 10% who can't be vaccinated, we then created a vaccination regime where we tried to vaccinate as much of the other 90% of the population as possible in order to achieve something called herd immunity, which you might have learned a little bit about in your biology courses. In developing countries, what they also did, put self-isolation measures, lockdown measures, put out those public health campaigns. They did everything the Western world did, but they also had to deal with a few other things. So especially in areas where there was poor hygiene, they might have distributed, soap, water, and reusable masks. They may have needed to create isolation zones, especially for people who are living in really cramped housing who may have gotten COVID, to isolate them from other people. They created triage zones. So triage is something I'll talk about in more depth in a minute. But it's just a way to sort of separate the highest priority people from the lowest priority in terms of who needs to be seen first, how bad is their health, and who needs to be seen first and treated first. That's what triage is. And also increasing access to PPE for doctors in those countries in order to prevent the spread of infection. Okay, so what is triage? Now, before I actually go on to that slide, does anyone in the audience, does anyone know what triage is? You can just type it in the chat, and if you don't know, that's fine as well, and I'll go through that in a minute, but I'll just give you guys about 20 seconds. Okay, I'm going to take the silence as a no, so we'll move on and I'll tell you guys what triage actually is. So triage is, it's a concept that we use. Oh, someone said something in the chat. Let me have a look. Oh, Amelia, okay. When patients come in and you look at their needs and sort out who needs treatment based on priority. Yes, perfect. That's a very good definition, Amelia. Thank you. So as Amelia said, that's exactly what it is. So it's commonly used in A&E and zones of conflict to maximize healthcare, to offer the best healthcare for that person based on clinical need and priority, rather than treating everyone at the same time when actually someone is in a much more critical state and needs immediate attention, whereas another person has a minor injury and can be left for a little bit longer before you go to treat them. So it's about prioritization. So as Amelia said, it's the definition is to treat patients in order of priority to ensure that their needs are met. And it's used usually when the healthcare system is overloaded. So things like war zones or natural disasters, people usually triage their patients. And you sort of do something called tagging. So you tag them with different colors, each patient, and that helps to identify which patients needs to be seen first and which patient could be seen a little bit later. So this diagram here just tells you sort of what kind of colors people can use. This does vary a lot depending on what sort of medical group you're working with. So just because here on this diagram it says level 1 resuscitation is blue, that the color might not be the same. It depends on the team you're working with and what colors you agree, to be honest. But usually the general rule is the triage system works as red is, it's a life-threatening condition. They need to be seen immediately. Yellow is, it is serious and it needs immediate attention, but they have a much better chance of surviving compared to the reds. Green is minor injuries. They're not life-threatening. They can be seen a little bit later. And black is usually they've passed away. And white is they have no injury. They're absolutely fine. Okay, so that was a little bit about triage, a little bit about different humanitarian crises. I'm going to go on to talk a little bit about Médecins Sans Frontières, just because it links with medicine and doctors quite a lot. So it's a non-governmental organization and it offers humanitarian aid across the world, depending on wherever a humanitarian crisis occurs. They usually do a lot of work with communities who have been affected by HIV and AIDS, tuberculosis, which is shortened to TB, COVID in recent years, hepatitis C, which is a viral infection that affects the liver and the rest of the body as well, and makes you prone to more diseases, tropical diseases, so things like malaria, and then water and sanitation facilities. So they try and help people who have limited access to water and sanitation. So SixMed actually has a very close tie with Friends of MSF. So what we're doing as part of SixMed is we're aiming to raise about £5,000 for humanitarian aid in Ukraine. And what we're hoping to do is for this £5,000 to be able to pay for one of our emergency doctors to be in Ukraine for 2 months to deliver healthcare. And we're raising money, and also on top of that, with our resources that we sell on our website, 25% of all the purchases that you guys make on SixMed in the month of March will be donated to MSF as well. Our progress so far, this is just a screenshot I took yesterday before I finished off this presentation, is about, we've raised about 36.8%, and that's our goal to our £5,000. So moving on, so if you guys are interested in donating, that's absolutely fine, but you can also do other things if you don't want to donate, so you can try and promote the fact that we are doing this as well. Moving on, let's talk about some some medical specialties now. So a little bit of interaction again, if you can type your answers into the chat. So can you guys think of any medical specialties that work with humanitarian crises? Just type your answers in the chat. I'll give you guys about 45 seconds again. Yep, surgeons, someone has said, which is right, yeah. Any particular type of surgeons that you can think of? Okay, yeah, someone said trauma surgeons, nurses, yep, paramedics. Yep, ER, emergency doctors, yep, pediatrics, yep, perfect. Trauma, yep. Anyone else? Okay, let's review some of the different ones you can be. So you can do army medicine, which is just working within the army, and you sort of learn about trauma medicine, as some people have said, and or you can be sort of a general practitioner, but within the army to help other army doctors. Pediatrics, I think someone said, and child health specialists who work with MSF. There's a massive sort of a branch of medicine for the child health within humanitarian medicine, especially helping children with things like famine, malnutrition, when they're born, looking after the maternal and the child's health as well. Women's health specialists, some of you may have heard of, working to improve sexual health care, because in a lot of countries where you have humanitarian crisis, there might be limited access to contraceptives, or, you know, people and men and women might have contracted HIV or AIDS. So how do we help these people? So that's what women's health specialists might look into. Emergency medicine specialists, I think someone mentioned that in the chat as well. So those are the people who will be doing sort of A&E medicine. If someone's injured, what do you do? They'll be the first ones there. And then they're also the same people who do that triage system of who to see first. Then we have public health specialists. So public health specialists are slightly different. So they sort of aren't actually in the conflict zone. They might be, in order to do some research about what's going on, what's caused this humanitarian crisis, what are the healthcare problems that have resulted from this humanitarian crisis. And then they sort of look at the epidemiology of everything in order to try and come up with a solution and see how we can help as many people as possible. And I think someone already mentioned trauma surgeons. Trauma surgeons, obviously, if you have an injury, they're the ones who will be treating you if it's a surgical issue. We also have general surgeons. So general surgeons and trauma surgeons usually work together to deal with things like gunshot wounds, say if it's a conflict-related humanitarian crisis, for example. Yeah, general surgeons, because they're able to work with most of the parts of the body, they work really well with trauma surgeons as well. Okay, so there's a vast variety of medical specialties that you can get involved with working with these humanitarian crises and working with MSF. So these are some kind of things which I may have piqued your interest in, or you may be considering already. So it's just to show you that medicine is really versatile, and there's so many different branches that you could consider going into. So hopefully you guys find that interesting as well. So let's explore some career options. So MSF doctors is something that you can do as well. So these doctors work on various projects, and they're mainly focused on treating lots of different problems, some of which include things like malaria, malnutrition, HIV and AIDS, TB, conflict injuries and trauma, and tropical diseases as well, as I mentioned previously. I've added 2 links here, which I can post in the chat at the end of the session if anybody's interested. So this is just how you get involved with MSF and to become an MSF doctor. And also there's the picture on the right here shows a man called David Knott, and he's a war surgeon. And he's written a book, and he's got his own website as well, and it's called the David Knott Foundation, and it's again to offer humanitarian aid to places where they've had lots of humanitarian crisis and have been affected by conflict and political unrest. Okay, so I'll post those links at the end if anybody's interested. Okay, so that was the end of my session. So on a scale of 1 to 4, how confident are you guys with this topic now? So if you can again type in your answers, 1 to 4 at the end. Okay, perfect. So it's a 3 or a 4. Perfect. Okay. So thank you guys for joining this session. It ran a little bit shorter than I was expecting it to, but we have some time for questions if anybody wanted to ask me anything. If you had any questions about sort of applying to medicine or so not related to this topic, applying to medicine, personal statements, UCAT, or which universities you were thinking of applying to, I can help answer that as well. So post your questions in the chat. But if you don't have any questions, that was the last slide, and hope you enjoy the rest of your Sunday as well. But yeah, I'm happy to answer any questions at the moment. If you want to unmute yourselves and ask a question, that's fine as well. Or if you want to say something in the chat, that's also fine. Thank you. Oh, someone's raised their hands. Is it? Do you want to unmute yourself and answer a question? Someone's asked a question. When's a good time to start preparing for the UKCAT and BMAT? That's a really good question. Just to ask, just because I'm a little bit curious, Devanshi, are you in which year are you in at the moment? Year 12. Okay, so that's perfect. Year 12 summertime. So I think July, August would probably be June, July, August would probably be the best time to start sort of practicing for your UKCAT and BMAT. I would say if you're deciding to do both the UKCAT and BMAT, focus on UKCAT June, July, August, and maybe write the UKCAT at the end of August, and then start preparing for your BMAT from September, because I know that's a set date, isn't it, in November. So September, October, you'll have time to revise for the BMAT. UKCAT, actually, it's more about the more you do it, the better you get at it. You can't really revise for it because it's more of an aptitude test. So you just need to keep practicing the types of questions and get used to them. And the main thing with UKCAT is answering it in the timed conditions, because you may not realize it, but when you're actually in the exam, it's a lot of about timing and being able to answer the question quickly and being really sort of tactical with how you read each question. For example, with verbal reasoning, they'll give you a massive passage, but they don't expect you to sit there and read the whole passage because you only have about 40 minutes for that whole verbal reasoning section. So you really need to use your time wisely and pick up keywords and find those keywords in the text and then answer the question. So UKCAT, just to summarize, I would start studying end of June, and then July, August, write the exam at the end of August, and then BMAT start preparing in September and write it in, the date they say. I think it's November the 4th or the 5th. It's usually the first week of November. Hope that answered your question. Perfect. Okay, thank you. Could you recommend where I could get some medical work experience? Right, yeah, so that is a little bit of a tough one, especially for the past few years because of COVID. But since things are opening up now again, should be able to find somewhere. So what I would do is medical work experience. They know, all of the interviewers and medical schools know it's very, very hard for year 12 and year 13 students to get access to medical work experience. So what you could do is, if you're able to find it, that's perfect. So GP, your local GP, go and speak to them, say you're interested in, considering a career in medicine, you're applying to medical school and you want to sort of shadow them for a week or a few days. So speak to your local GP or, a GP near you if you don't want to go to your GP. Local hospitals, you may be able to email them or call them up and ask them for hospital placements. Usually it's a little bit harder to get hospital placements unless you know someone like a medical student or a doctor in that hospital. If you're really finding it hard, there's an Brighton and Sussex Medical School online work experience that you can do, which is counted equal to a face-to-face one on your medical school application. So you can do that one to try and get a little bit of insight, and that's a 1-week online course. And there's another online virtual work experience as well that you can look up, which they do over the summer. If you're really, really struggling, I would say don't worry about work experience. Volunteering also counts as work experience. So you can go and volunteer in a care home. What I did actually, I went and spent 1 week in a residential care home called, and it's a company that runs it called Revitalize. And they have 3 different branches. They have one in Southampton, one in Scotland, and then one in Essex in the south. And you go and spend a week there and you sort of look after the elderly people who, you know, will have lots of diseases, and you can always discuss that in your interview as well, and that's counted as work experience. And that's always good experience to speak to elderly, see what it's like for them having lots of different diseases as well. So yeah, I hope that answers your question about work experience. Moving on, someone else has posted something. As a career changer, is it necessary to have A-level sciences to enter medicine, English teacher, any other routes? Bit of a broad question. Okay, so that's an interesting question. So is it necessary to have A-level sciences? I think the only science that you definitely need to have is chemistry. With most sort of entry requirements for different medical schools, the main thing is to have chemistry. But if you're applying as a graduate, say, I'm not sure obviously about your situation, but if you're applying as a graduate, I think the main thing is your GAMSAT exam that you need to do, which is similar to UKCAT, but it's sort of a longer exam that you guys need to do. I'm still not 100% sure if you need to have any other sciences, but I definitely know chemistry is something that all medical schools look for. If you don't have biology, I think it's only a few medical schools which you won't be able to apply to. But yeah, most of them look for chemistry, and that's absolutely fine. Hope that kind of made sense. If not, just ask me a follow-up question and I'll try my best to answer it again. Okay, different question. Okay, perfect. Thank you. Yes, I'm an English literature grad. That makes sense. Perfect. So yeah, I think it's just mainly chemistry. Not really sure why they focus more on chemistry than biology, when biology is the one that you sort of base your first year of medicine on, but it's chemistry that they look for in terms of entry requirements. But I think what I'd recommend you do is whichever university you're interested in applying, maybe look into their entry requirements for graduate applicants and see what they say, and go from there. Hopefully that helps, Amelia. Devanshi said, I volunteered at my local vaccine centre. Would that count? That, yes, that would count as work experience as well. You can talk about the way they sort of ran that vaccine centre. So what kind of roles you had, what did you observe? How did you observe everybody else at that vaccine centre work together? So the healthcare staff. So with work experience, the reason why medical schools would like you to have it is just so that they know that you've observed what medicine is like and how different people within the healthcare system work together, and for you to be able to reflect on that. So yeah, your local vaccine centre, you can definitely talk about that, and you can say, you know, I saw everybody else work in a team in order to deliver these vaccines to all the patients who came in, and they worked really well and they were efficient with their time, and that's the kind of thing they want to hear you talk about at your interviews and in your personal statement as well. Hope that answered the question. Perfect. Anyone else have any other questions? Now, this could be about personal statements. This could be about how do you actually apply to medical school if you're quite early on and you're thinking about that. What schools I applied to, I could, you could ask me that if you wanted to, or what schools you're thinking of applying to, and things like that. Anything. I'll stay on the call for until 11 to answer any other questions. Or if you guys had questions about the topic I've gone through, so the humanitarian crisis stuff, I can try and answer those as well. Oh, someone said something. Is it worth applying for a foundation course before medicine? So just to try and understand where you're coming from, have you just finished A-levels and you're applying for medicine, or what sort of situation are you in, just to get a little bit more information so I can answer your question best? I'm going to A-levels this May. Okay, perfect. So I think the only time you would sort of consider a foundation course is if you weren't, is if you didn't get the grades for your A-levels, or if you were applying as a grad and you didn't have the sciences or certain courses, and you wanted that foundation year before you came into first year of medicine. And that's the only situation where you would need to do a foundation course. I think it's worth double checking with the university where you've seen that they've offered this foundation course before starting medicine, what sort of entry requirements they need and who they usually take in. If you're going to do A-levels this May, I would just, have you already applied for medicine then? You must, or are you doing a gap year? Because I would say if you've applied, you could just take a gap year and then apply for medical school in the following year. Haven't applied yet. Okay, so apply for medical school in the following year, and within that gap year, do as much medical work experience as you can. Yeah, I think with the foundation courses, it's worth asking the individual medical schools because each of them will have slightly different requirements. Hope that answered your question. Okay, someone else has asked, do GCSE or Igcse grades really matter? Unfortunately, I didn't do that well in them. I got 6 A's and A stars in total out of 9 subjects. Okay, so with it depends on the university you're applying to, is the answer to that question. And I'll give you an example. So I applied to Bristol, and I applied to Cardiff, and I applied to King's and to St George's. Bristol and Cardiff, they put a lot of weight on your GCSEs. They did anyway when I was applying. It might have changed now. And Cardiff actually was very, very particular with GCSE grades, where they had a point system where if you get an A star, you get, for every A star you get 3 points or something like that. And then for an A, you get 2 points. And then for a B, you get 1 point. And then for anything else, you get no extra points. And based on the amount of points you get throughout your whole medical school application, you then get invited for interview, or you don't get invited for interview. So that's with Cardiff. Bristol, again, had a lot of weighting on the GCSE grades you get. But other medical schools don't. So Keele, for example, doesn't look at GCSEs as much as they do A-levels, and similarly some London schools look more at A-levels rather than your A-level predicted grades or your A-level grades rather than your GCSE grades. So it really is dependent on the specific university you're applying to. So if you feel, I think actually 6 A's and A's are absolutely fine. You can apply to most universities. So it's nothing to worry about. But if you're really think this is the university I want to go into, and they put a lot of weight on their GCSEs, I would still apply to them anyway. But if you feel like you may do better at a different university, then I would recommend applying there. So then you're increasing your chances of getting all 4 offers. But yeah, that's the answer. Perfect. Any other questions? I'll stay on until 11, as I said, so if anyone has any other last minute questions, feel free to ask them. Oh, someone's asked, how did you structure your personal statement? Oh, very good question. So personal statement, it's a reflection of who you are, and not just why do you want to, you're not just answering the question, why do you want to study medicine? You're also telling those interviewers, this is who I am, this is my interest in medicine, but I also have other interests, and talking about your hobbies as well, showing that you're a well-rounded person. So the way I structured my personal statement, first paragraph is always answering the question, why do you want to study medicine? And what have you done to show your interest in medicine? So it will be things like my interest in studying medicine first started when I enjoyed doing sciences, and then because I really enjoyed the sciences, I decided to explore the option of medicine, and then I did this work experience, or I did this volunteering, and I learned this and this from it, and that's why I thought that medicine is the right career for me. So that would be your first 1 or 2 paragraphs. Then you would go on to talk about your hobbies. So I talked about playing the piano, reading, doing extracurricular activities and sports and things like that, and what sort of makes you a well-rounded person, because they want to know that if you do become a medical student, will you be able to handle the stress of being a medical student and a doctor? Do you have hobbies to offer you some sort of stress relief? So talk about your hobbies. And then I would talk about any other achievements that you've had. So if at school, you were the top scoring student for something, you can talk about that. So any sort of personal achievements, or if, for me in piano, what grade did you get up to? How well do you play? So what sort of passion do you have in terms of hobbies? So you can talk about that. And then the last paragraph, which will be your concluding statement, you come back to why you want to study medicine. So a personal statement is like a loop. So you talk about why do you want to study medicine, then you talk about, a little bit about you, who you are, what your hobbies are, and then you're coming back in a loop and saying, why do you want to study medicine again? So to sort of reiterate the fact that these are all the reasons why you want to study medicine and why you would be a good doctor. Does that sort of make sense in terms of structure? Perfect. I think someone's asked me a question on the Q&A. Let me see. How can you get a good UCAT score? Okay, so with UCAT, it's all about practice, and practice specifically under timed conditions. And the reason why I say that is because different sections, say verbal reasoning, quantitative reasoning, abstract reasoning, they also have different times within which you have to answer a certain number of questions. So doing online practice question banks under timed conditions is really important. That's one way to get a good UCAT score. Another thing is if you get an answer wrong, don't just, I used to do this in the beginning when I did my UCAT revision, I would just sort of skip it and not really look at why I got it wrong, but actually spend a lot of time sitting there and thinking, why did I choose this answer versus the one that they've said is the right answer? Because if you're able to fix it as you go along, the way you answer the questions, you'll get a lot better. You'll see that you're improving a lot faster than if you just skip the incorrect answers and then continue doing more and more questions. The other thing is, I would say for verbal reasoning, the main tip I tell everyone is don't read the whole passage. You read the question first. You identify what they're trying to ask you in the question. You look at the answer options because they're all multiple choice. And then based on the answer options, you then look at the text and you're scanning to find the keywords in the text to see which part the question is addressing, which part of the passage the question is addressing. So that's for verbal reasoning. For quantitative reasoning, mental maths. So practice your mental maths. You need to remember to do addition, multiplication, all of that sort of basic stuff in your head, percentages and things like that, and probability and all of that. Try and train yourself to do that in your head. Sometimes it is hard. You do get an online calculator access, but it just wastes a lot of time trying to type in numbers and sort of answer everything. So try and practice your mental maths. And then abstract reasoning is recognizing shapes. So with different shapes and different patterns, there's sort of a if you go on those online question banks, they will teach you that these are the common patterns that crop up in abstract reasoning. And if you really can't find a pattern, just flag the question and move on and come back to it, because you may not see it in the beginning, but when you come back to the question, you may see it again. So that's with abstract reasoning. And then what are the last two? Oh yes, there's decision making. The names might have changed a little bit since I did the UKCAT, but when I did it, so decision making was sort of just decision making is the easiest because it's sort of a little bit of maths questions and a bit of probability and sort of trying to figure out that they'll give you a question and they'll say there's 5 students and one person did this. It's sort of like an aptitude test basically, so that tends to be the easiest, but again practicing lots of those questions is important. And the last one is situational judgment. Now, situational judgment, you don't get a mark for it, you get a band, and you get band 1, 2, 3, or 4. Usually if you get a band 3 or a 4, very few people who have those bands are invited to interview. It's only if you get a band 1 or a band 2 where you're more likely to get interviewed. And the reason for that is the situational judgment is just to see what kind of choices you would make based on a hospital scenario or a medical scenario that you're given. Usually, most people score 1 or 2. It's very, very hard to score a band 3 or a band 4. And for that, all you need to go look up is there's this document called the Gcse guidance or good medical practice to being a good doctor. So I'll actually type that in the chat if you guys want it. If you search that up online, it should come up with this document on the Gcse guidelines, and it just tells you in this situation, this is what you should do. So if they give you a scenario like, you know, you're a medical student, you're on placement, and you see another medical student taking medical equipment from the stock room, what would you do? And they'll give you 5 options, and you have to sort of say, this is the thing that I would do first. So would you take them to a side room, ask them why they're taking the equipment? Would you escalate it to someone else, and would you say to them, oh, this medical student is taking the equipment? So it's sort of seeing what you would do and what your responsibilities will be as a doctor and how you'll deal with these difficult situations. So that's what situational judgment is. So I would say situational judgment is one of the most important ones because they look at the score for that separately and determine whether or not they'll offer you an interview. But again, that if you read that Gcse guidance, that really helps. That's sort of like revision for that session, for that section, sorry. Hope that answered your question, Maria. Does anyone else have any other questions? Perfect. Sorry, I just remembered it's actually called this good medical practice. It's called the exact name, I think. If you look that up. And that good medical practice guidelines, they're also really, really helpful for when you do your interviews, because if you get role play scenarios, they usually refer to guidelines from the good medical practice. Any other questions? If not, we can all go and enjoy the rest of our Sunday. Okay, perfect. So thank you guys for all attending, and hopefully this talk was quite good, and it helped you sort of realize that there's loads of different areas of medicine that you could go into, and you understood sort of different humanitarian crises. If you would like to sort of donate to 6med or purchase one of our books, as I said before, 25% of it goes towards MSF. So yeah, thank you so much for attending. Okay. Oh, someone said, can you apply for medicine with a foundation year after getting your A-level results? I'm not sure if they're still here, but I will just answer it so it's recorded and you'll be able to access it. I'm not sure about that, so that's something that you'd have to look into. So I can't really answer that question. So I'm not too sure about whether you can apply for a foundation year, but I think that's something that you can look into on the specific medical school websites as well. Okay, I'll stop the recording there.